Dr. Siobhan Dunnavant, State Senator Henrico, is with us now. Dr. Dunnavant, you've got a surgery at 7:30. Thanks for being with us today.
Thank you for having me, John. I'm glad to be here.
Now, when we talked yesterday, it was a riveting conversation you had with me. You kind of laid out what the governor should have done, what you would have done if you were governor. But can you talk about the masks, why you think that there's no downside with them? So let's start with that, and then bridge to why you were infuriated with a mandate. Dr. Dunnavant, go ahead.
Right. So I would say, for starters, I am grateful for your compliments, but really dealing with this situation for me and the way my brain works has been, very much the same way I deal with things in medicine, and that is to get information and to vet that information so that the decisions I make and the opinions I hold are grounded on good science and good data. And that's been a problem, and eventually we'll talk about the data because I think that we need to talk about that, especially when you talk about 100,000 dead. But if we apply that concept to how we manage COVID in this situation, I think we can all recognize that in the beginning, we didn't really have any data. And all that we could think of and what was recommended is that we stay at home and make sure we decrease the likelihood of contaminating each other and having an untold, death count. But we've learned a whole lot since then, and we know a whole lot more. And we don't need to stay at home anymore to protect and to prevent an untold death count. And that really brings us a little bit to the conversation about masks. There's a lot of debate about masks out there. And the story is scientifically that the masks being used for COVID are not, the goal of the masks is not to prevent you inhaling virus, because viruses are very small molecules. It's really not to protect you at all. A mask being worn right now for COVID is to prevent you from putting droplets on a surface. COVID is transmitted, not aerosolized, not floating through the air where you can inhale it, but on little drops of fluid that may come out of you when you speak or sneeze or cough and land on a nearby surface. They fall to the ground very rapidly because they're heavy. That's why staying 6 feet apart works. And if you can keep those droplets from getting on surfaces, you protect somebody around you from inadvertently picking that virus up by touching the surface. You contaminate yourself and put yourself at risk of COVID by touching your nose and mouth and mucous membranes and introducing the virus from a droplet into your body. But if you're, say, at the store and you cough or sneeze or just spit, we all spit a little bit when we talk, and you put a droplet on a surface and the person behind you steps forward and picks up that droplet, if they have an 80-year-old compromised parent at home, then they are running the risk of taking that home to that parent. So we wear masks for others. Masks don't protect you. They protect you from contaminating other people. The reason I think it's safe to make decisions other than staying home is that we know there are discrete populations that are really at risk for this virus, and that's some of the science we've learned since this all started in February or March. And those, as we all know, are elderly, especially 75 and older, and those with chronic disease, specifically diabetes, hypertension, obesity, and heart disease. So our job as we move forward will be to kind of protect those discrete populations. And then I think that one of the things we talked about yesterday, John, is that as we go forward and when we make decisions, you want to inform those decisions with good data and information, but you also want to make sure that you make decisions based on goals that you have. And that's where I get frustrated. To me, the goals we have are to protect lives and to protect livelihoods. We need to get back to work and protect our economy that was robust before we all electively went home and basically shut down the economy. So with that in mind, I think when we get distracted with a conversation about mandated masks, we are absolutely distracting from making a decision based on our goals. I would say that wearing a mask has very little risk. There's a lot of stuff out there about carbon dioxide and other things, but all in all, the risk of wearing a mask is very small. We don't have absolute data. Data takes a long time to develop. We don't have absolute data that wearing a mask is going to completely prevent this, but it makes some logical sense using critical thinking, knowing that it's droplet spread, and it causes little harm. I would say if wearing masks is what we need to do to get back to work, it's a fair compromise and a fair middle step between staying at home and shutting down our economy, or maybe moving forward and opening it up. And we'll get more data the more time we have, and we'll know if masks work or not. So let's talk about the mandate. I think that we are at a point in the crisis where we are on the downslope of the crisis. This is not going to go away. You know, all evidence is that people will have COVID ongoing, and we will have deaths. Hopefully they will be very limited numbers, and hopefully they will, that we will be able to find better treatments for people that have it, and eventually maybe a way to prevent people from ever getting it, like with a vaccine. But if we set the goal of this is going to go away before we can do anything, we're never going to be able to do anything because this isn't going to go away. Other states, we know, if you want to look at evidence and data again, Alabama and Florida have been open for over 3 months.
Right.
3 weeks. They have not mandated masks, and yet the data that they track to make sure we have this virus contained, and those two data points are percent of the tests that you do that are positive and how many people are dying, those are both continuing to be on a downward trend. So mandated masks are not necessary. I think also the mandate upsets me because when you talk about incentivizing people, you can incentivize them by giving them a vision of how we can move forward together.
Right.
And for me, that vision is we can both protect life and protect fiscal health or our livelihoods. And that's a vision that I think you can engage everybody in Virginia in. And I will point out that there was never a mandate that we stay home. There were no misdemeanors or fines for us staying home. So not only do we not need a mandate to accomplish our goals, which are decreasing the numbers of COVID and also opening the economy, it's the wrong way to accomplish the goal of mask wearing. If you have a patient, he's a doctor, I'm a doctor, we persuade patients to do things to improve their health that are inconvenient, uncomfortable all the time. But you don't get a patient to get on board with a medical plan by saying, you have to do this, do what I say. Mm-hmm. You get a patient on board with a medical plan by explaining what I just did about masks and why there may be merits for them buying in. Mm-hmm. We talked yesterday about a study that came out of the United Kingdom, and I'll make it available to you if I haven't already sent it to you, but you can share it with your listeners. And the United Kingdom looked at scientifically what was the best way to make sure we keep the cases low. And they compared staying home indefinitely versus going back to work after a while and wearing masks. And they looked at two groups of mask wearers, those that wore masks, 80% of the population wore them, and a situation where 50% of the population wore masks. The lowest rate of transmission was going back to being back in public more and also wearing masks when 80% of the population did it. Think that we can have a conversation with Virginians and say, I know you don't like wearing masks. I know it may not be 100%, but our goals are get back to work and protect other people.
That's the whole thing. There's no conversation. There's a press release and there's a mandate, and there's no conversation. If Ralph Northam said what you just said and said, look, there's a little downside in wearing the mask, there's some upside, It's not the end all be all, but maybe it helps a little bit. Let's do it. But here's the deal. If you do it, here's what I'm going to do. I'm going to go to phase 2 Friday. I'd be like,
Exactly.
okay, I'll wear a mask. I'll go to phase. I just want people to get back to work center. I just want businesses to be able to survive. I just want people to be able to feed their kids. So if I have to wear a mask and that's the deal I make, I'll do it. But instead, here's what we get: press releases, mandates, no dialogue, no conversation, no input from Dr. Siobhan Dunnavant, nothing. We get a press release and a mandate, and then it's followed up with, well, I tell you what, right now I really can't find your ass, but here's what I'm going to do. I'm going to have a special session. I'm going to spend your money to bring everybody back in July. So I'm going to take your money so that I can pass a bill so that I can fine you for not complying with my order, which I've not backed up with anything. That's the problem, Dr. Dunnavant.
Right.
That's
And
why
that's
people
what
are so
scares
upset.
Me. Yeah, that's what really scares me, and that's what we talked about yesterday. And first of all, you're insulting Virginians by not involving them in the conversation by explaining why mask wearing works. But secondly, I am really, when he calls a special session, and we've tried to get a special session called but it requires 2/3 of the Senate and the House, and we couldn't get the Dems on board with us. When he calls a special session and he limits our conversation, and this is what we don't know, it's not in writing, we don't know what's actually happening. I haven't been notified there's a special session. I heard the press conference like you did, or it was shared with me. I was at work. So he says he's going to call a special session for us to discuss COVID penalties. So right now, a police officer cannot stop you if you're not wearing a mask. They can just fine businesses that they license if they don't require masks being worn. But I interpret what he said, and again, I have nothing in writing to counter that he, in Hawaii, if you're not wearing a mask, in some states it's a misdemeanor. In Hawaii, it's a $5,000 fine. Talk about our economy. I am terrified we're going to go back into session, and the Democrats who have the majority in both houses are going to pass something that would allow law enforcement to stop you on the street if you don't have a mask on or fine you. This doesn't get us to the point where we're focused on health and fiscal health. This is now a whole nother argument and debate of passion that distracts us from what we should be doing together. Everybody pretty much agrees that we want to open up the economy, and they're extremists on either side. But, I think if you really talk with rational people, they want both. And so I agree. And as I said to you yesterday, if there was ever a time for Virginians to step forward and have a conversation civilly and respectfully, but really lobby the Democrats to make sure that no legislation, if he calls us back for that purpose and legislation comes forward, we need a few Democrats to kill it.
Well, can you get 2 Democrats in order to do that, Senator Dunnavant?
I think so. I don't know. I mean, I haven't talked to the other legislators because we don't even know if we have a session. I don't know. We have to. We need to point out to them that Virginia stayed at home on request. We collaborated. We worked together. We did what we were asked to do, and we all bought in. And we can do that again with mask wearing. Mask wearing has not been necessary in other states to make sure that we keep from having another major spike. So I think that there's a reason here and a conversation that can be had, but I am really, really worried that legislation would be passed that would violate, in my opinion, the Constitution of Virginia. I believe mandating masks when the crisis is on a downslope is a pretty egregious overstep of what was intended with emergency orders. And I really think I have my team looking at the longest state of emergency that's ever been in Virginia before. But I think 2 arms of government need to be opened unless there's no other choice, and that 2 independent arms that can have a conversation and disagree are really important at protecting our constitutional freedoms. And I think we need to have the legislature open so that he can't keep acting unilaterally.
If you were governor and you laid this out to me, because I don't want to wear a mask because it's been mandated to me, and I resent that, and I'm not sure that it works, but I'll take your word for the fact that there's very little downside, very little upside, but why not? Okay, I'll buy that. But if you were governor and you had this conversation with Virginia, with a resident like me, and said, look, I want you to wear a mask, but I'm going to make it up to you. But look, it's a good thing, not a bad thing. But here's the deal. I'll go to phase 2 Friday if you wear a mask. I'd have bought 10 of them, right? I just want to get to phase 2. But now I'm mandated to wear a mask. I have no incentive to do it. I'm not told there's any reason to do it. I mandated it, and now he's going to have a special session so he can fine me $5,000 if I don't wear it. So I'm not going to wear a mask. So it has the opposite effect on what he's trying to do. This is the worst governor. At least Phil Murphy is a jerk, and he admits it. He says, I'm not going to open up New Jersey until I want to. Fire me. Okay, well, they'll have that opportunity in 2021. This guy has no accountability. There was no dialogue. There was no collaboration. I mean, if he had this press conference and you were there as a doctor and a state senator in a bipartisan way, I'd have bought into it. But I'm not going to do anything he says. And so my next question is, you're the best one I've had on my show. I've talked to 50 people on this. You've got the best response. Have you thought about running for governor in 2021?
I haven't, and I thank you for the compliment, but I really like being a doctor, and I ran to really be up there and solve problems and use critical thinking and data and conversation and persuasion to get things done that we all want done, but politicians tend not to talk about. And so I don't have any intention of running for governor, but I'll give you an alternative plan. We don't hold a position. We don't have a majority in either house. We don't have the governor's office, but thank you for the opportunity to be on and speak with your listeners. We can do this together, and we can do it. We don't have to be governor to do this the right way. We can have a conversation. I can share this information like I'm sharing with you. You can spread that information, and we together can say, Governor, you've overstepped. I think we need to put in place some checks and balances so governors can't keep an emergency order and an emergency situation in place so long without any other counterbalance by the government as it was designed with 3 separate and independent branches. We can make all these changes going forward, but I don't think that we need to say, I'm not wearing a mask because you told me to do so. I think we need to do the right thing where he's failing to do the right thing. I think we need to say, you're out of line. We want to go back. You're trying to distract us. You're trying to get me to talk to you about masks. It's kind of like my teenage children when they were teenagers. You want me to talk about something else besides what you're supposed to be doing, and I will not get distracted by your derailment. We are going to stay focused on opening up and protecting livelihood, and you do not have scientific evidence to support a mask mandate. So get back to work. We want the state opened. And so, I think that's what we need to do together.
We're out of time. I want to thank Dr. Siobhan Dunnavant, State Senator, Republican from Henrico. Dr. Dunnavant, thank you for being with us. I know you have a surgery at 7:30. You got to go.
Thanks, John.
Thank you for making time. We need to keep this dialogue going. You need to be the face and the voice of reason because right now we're not getting it. Dr. Siobhan Dunnavant, thanks for being with us today.
Thanks. Bye-bye.